All right, well, I think we'll get started for the day. Welcome everyone to today's webinar. Thank you for joining us. My name is Emery Wolf. I'm the Technology and Multimedia Specialist with the SRNA, and I'm here today to help facilitate the webinar. Before we start, I would like to acknowledge that we are presenting from our respective offices here in Regina, which is on Treaty 4 territory and the homeland of the Métis. Our topic today is part of our Emerging Trends in Health Care series, and that topic is on healthy RN workplaces. So what is a healthy RN workplace, and how can we support the development and maintenance of such a workplace? Our guest today is Joan Wagner. She's an associate professor at the University of Regina. She teaches a course on leadership there, and she leads a bunch of research on this topic today. So just before we get started, a couple of notes. As a viewer of the webinar, you will be able to hear and see the presentation only, and only the panelists will be able to speak throughout the presentation. So if you have any questions, please use the Q&A box or the chat sections to ask those questions, and we'll either respond through the questions, through the Q&A and chats, or we'll respond to it in the actual video. We'll also be recording this, and it'll be posted to our website and our YouTube channel later. Then after everything's all done, an email will be sent out to you with a link for the evaluation, and we hope you take a couple minutes to fill it out, just to let us know how we're doing and where everything goes next. So yeah, now with that out of the way, Joan, do you want to take over?
Certainly. Thank you very much, Emery. It's my pleasure to have this opportunity to share my research about workplace health with you. I've spent many years as a healthcare leader in Alberta and in Saskatchewan. During this time, I often pondered on what is a healthy workplace. This question led me to wonder how I could facilitate and support the development and maintenance of such a healthy workplace for everybody. Thus followed my research on developing a healthy workplace model for nurses. Creation of a healthy work environment is essential for the recruitment and retention of workers. This is especially noticeable in healthcare, where the changing demographics of aging Canadians are increasing the load on the formal system of care. So, yes, I'll just move this slide forward here. There we go. What is a healthy workplace for you? What do you need to be happy and productive in your workplace? Please take a few minutes to think about this question. As you are thinking, I will talk about what I consider to be a healthy workplace. Much of my work time is spent reading about and conducting research on what makes a healthy workplace. However, when I was asked to present on this topic, I decided to sit down and make a list of my personal priorities for a workplace. If I was to create a personal workplace of my dreams, where I would be happy and productive, what would be my priorities? So if you created a list of your priorities, what would be your priorities? Please continue to think about that. And take some time to just blue sky. Think of the priorities that would make your perfect workplace, where you would be very happy and productive. So back to my dream workplace. The first things that came to my mind were the typical things such as compensation, job security, healthy organizational politics, and appropriate working conditions. And what do I mean by appropriate working conditions? Clean, well-heated, well-ventilated workplace with adequate supplies and up-to-date tools and equipment available to assist me to provide the best possible nursing care to patients or clients. I want to provide quality health care and make a difference to the lives of those who come to me for help when they experience health concerns. To provide quality care, I also need to have up-to-date knowledge and information on the conditions of my patients or clients. Well, in addition to all of those things, I also need good relationships with my colleagues and supervisors. I realized that I would never be happy at work if I did not have good relations with my colleagues and supervisors. I enjoy the opportunity to seek advice and support from my colleagues and I also enjoy the casual conversations held throughout the workday. I need the support of my entire workplace team, from the housekeeping administrative staff to the managers and directors of care. I want to be part of a community of caring people who support each other and are dedicated to the provision of excellent health care. Interestingly, as I looked at what I considered to be my ingredients for the dream workplace, I was drawn back to some research done on the construct of structural empowerment. A gentleman by the name of Cantor first published on structural empowerment in his book Men and Women of the Corporation, and this was first published in 1977. Dr. Heather Lassinger, a nurse from the University of Western Ontario, conducted numerous research studies within healthcare, looking at the importance of empowerment to healthcare workers, with a special emphasis on nurses between 1995 and her early death in 2016. So I thought we should maybe go back to the concept of structural empowerment, because this is something to me that really impressed me when I first heard about it. What is structural empowerment? Structural empowerment states that employees should be given control over their circumstances if they are to reach their optimal performance. There are 4 job-related empowerment structures, which are support, which means support from both your peers, your colleagues, management from the organization. Information, that's the type of information you need to do your job, whether it be education on the job, on the healthcare condition of your clients, or just information about how to use equipment and resources appropriately within the organization. You need to have adequate resources. If you're in long-term care and you don't have enough continent pads, it's very difficult to provide good care. And you need to have the opportunity for advancement, to be challenged in order to be happy within your workplace environment. So one thing we do know is that if a person is structurally empowered, that they will then have something that we call psychological empowerment, which is defined as a psychological state that employees must experience for empowerment interventions to be successful. Psychological empowerment has 4 different concepts that it's composed of. Meaning, work has to be meaningful for you. The individual has to feel competent. They have to feel that they have autonomy within the workplace, and that they have impact, or they're making a difference in the workplace. These 4 concepts combine additively to reflect an orientation in which an individual wishes and feels able to shape his or her work role and context. Also, we talked about the workplace environment. Now we need to look at the leadership. What we've really discovered is that relational leadership, leaders who work with people and develop relationships in an effort to meet the common goal, seems to be most successful in healthcare. And my research has been on resonant leadership, which emphasized the responsibilities of leaders to be accountable for both their own emotions and those of the people that they lead, while simultaneously building relationships and empowering followers through the sharing of expertise and knowledge. In other words, resonant leaders are those who listen to their followers and then act upon the concerns voiced by their followers. The new research that I brought into the area of healthcare was Spirit at Work research. Spirit at Work investigates the employee workplace perceptions of the psychosocial environment. It provides information about care provider experiences. So what do we mean about psychosocial environment? What is Spirit at Work? Spirit at Work is grounded upon the human ecological perspective and portrays the beliefs and experiences of employees who are enthusiastic and energized by their work. Spirit at Work, or esprit de corps, as some people like to call it, acknowledges the potential for workplace spirituality to improve individuals' lives and to assist employees to achieve their full potential. Individuals with high spirit at work believe that their work has meaning and they contribute to society, otherwise known as a sense of engaging work. They are connected to their coworkers and trust them, so there's a sense of community present. They experience a state of energy or vitality, also known as a sense of transcendence. And finally, they feel they are contributing to a greater purpose, also described as a sense of spirituality. In their research with staff in long-term care, two researchers, Dr. Konjerski and Dr. Skripnik, indicated that leaders need to focus on relationships and caring among staff while also supporting them to achieve the organization's purpose. Promotion of the psychosocial environment, the spirit at work, or esprit de corps within the healthcare workplace has been shown to lead to increased job satisfaction and improved patient health. So research is showing that increased spirit at work leads to improved patient health and increased job satisfaction. So I'm just going to take a couple more minutes to look at my research to show you what we looked at. This whole circle here is the theoretical basis. We look at structural empowerment right here. When you have structural empowerment, you then have psychological empowerment. When you have psychological empowerment, you have both job satisfaction, organizational commitment, and spirit at work. So in order to have, if you have a leader who is resonant, who's a relational style leader, what you will find is that there's research is showing there's increased structural empowerment within the organization, there's increased spirit at work, and job satisfaction is higher, and the individual's commitment to the organization is higher. We also find that when there's increased spirit at work, individuals have higher commitment to the organization. So that's just an interesting, what comes out of the literature, the theoretical relationships. So then, let's go to the next step and really talk about why spirit at work is important to healthcare. Spirit at work is a holistic measure of the psychosocial milieu of the practice environment. We know from research that spirit at work, environments with high spirit at work, have increased staff productivity and staff feel better. So there's increased staff well-being. We also know that patient safety and health are increased or better when there's a healthier psychosocial milieu or a greater spirit at work within the environment. So you say, why in the world are we talking about spirit at work? Why are we so concerned about it? Well, I think in the last, not even 10 years, it looks about the last 5 years, there's been a lot of information coming out in the healthcare workplace literature about what's happening. And healthcare leaders and visionaries across the world are expressing concern regarding the impact of the healthcare practice environment upon patient care. System-wide adverse events such as those in the United Kingdom and the United States prompted healthcare leaders throughout the world to explore approaches to improving the psychosocial work environment of their organizations. International healthcare research indicates that a focus on the psychosocial milieu of the practice environment leads to increased staff productivity and well-being, including reduced RN burnout and ability to deal successfully with workplace stress. Positive psychosocial environments foster increased RN job satisfaction and ultimately lead to reduced patient morbidity and mortality. Research also indicates that advancement in healthcare workers' well-being are linked to patient safety and patient health. So here we see the Francis report that came out of the United Kingdom revealed that the unnecessary deaths of up to 1,200 people between January 2005 and March 2009. And the investigation into these unnecessary deaths revealed that their system was focused on cost savings rather than provision of safe and effective patient care. The Francis Report and United Kingdom Healthcare Services became an advocate for a patient-centered culture after this revelation. Their solution, one of their solutions, was the Schwartz rounds, which supported all disciplines to reflect on the emotional aspects of their work, enhance communication with each other, and improve relationships with patients. They stress that quality relationships among staff are essential for quality client care. These rounds supported all disciplines from across the organization to look at all aspects of their work, not just the nurses, and to enhance their communication with each other. So then we look at the United States and the magnet hospitals, and I'm sure many of you heard of magnet hospitals. The magnet hospital model was originally developed to improve RN recruitment and retention. As researchers studied magnet hospitals, they soon came to the realization that improved patient outcomes were a direct positive outcome of the organizational reform of the nurses' work environment. There are significant relationships between these nurse-related variables and three patient outcomes. Patient adverse events such as infections, pressure ulcers, prolonged length of stay, mortality rates, failure to rescue, medication errors, patient falls, post-operative hemorrhages, acute myocardial infarction, congestive heart failure, stroke, and craniotomy. Those are the patient adverse events that there's research on that shows there's a direct relationship between nurse-related variables. Also, there's a direct relationship between nurse-related variables and cost of patient care, and a direct relationship between nurse-related variables and expected patient outcomes, such as the readiness for discharge. Magnet Hospital research from 2006 to 2015 successfully demonstrated this association between improved nurse variables and successful nurse and patient outcomes. So the research is really interesting around the world, the international research. But I did a small research project here in Saskatchewan, and I distributed a questionnaire through the SRNA. And the outcomes of this research were published in the SRNA Bulletin in 2015. In this survey, I looked at the RN workplace with special attention to horizontal violence. And what was horizontal violence? Lack of acceptance, bullying, and intimidation. And also described by Griffin as overt and covert actions by nurses toward each other, and especially towards those viewed as less powerful. So what were the results of the survey? You can go back into the SRNA newsletter and look at the results of the survey, because I explained them quite clearly. Or here is the graph that I pulled from that particular newsletter. And these are distinct components of horizontal violence within the workplace. And they were witnessed by 25% to 50% of all RN respondents. One of the statements that came from the respondents were, "It has always shocked me that nurses can treat other humans this way. I've witnessed in many areas that I've worked in, seeing how RNs treat co-workers." The most commonly witnessed experience of bickering amongst peer was witnessed by 50% of RNs. So I'll just stop and take a look at the graph. So we have all these 10 measures of horizontal violence. And the one that they've witnessed, those that are witnessed are in the dark blue. The lighter blue is those that they've experienced. And very light blue, the very light blue is they've neither witnessed nor experienced this particular behavior. So what I just said was the most commonly witnessed experience of bickering. Right here we go, bickering is one of the things that 50% of the nurses who responded to this survey saw bickering amongst peers. Sabotage or deliberately setting up a negative situation was witnessed least frequently. This is the one that they saw least often by 25% of respondents. So take a look at this. We talked about negative, nonverbal negative innuendo. So that's maybe making a face when somebody's back is turned, rolling your eyeballs or something. And people, it happened a lot of the time by about 45% and was witnessed by about 40% of the people. Verbal affront, that means insulting somebody or putting them down, happened in approximately 50% of the time. And so on as you go down the scale here. Okay. One RN, and I actually am giving you some direct quotes from the survey that RNs wrote in. One RN described her unhappiness with the organization by simply stating, "Very toxic systems generally. I will do whatever it takes to work outside of a health region's bureaucracy." So we have some very unhappy RNs within the bureaucracy. And what I hope to do is just show you that there are some solutions that need to occur, but it needs to be an effort by everybody, from the frontline caregiver, care provider, to the top line director and executive of the organization. Okay, so how do we improve the psychosocial work environment, or has my research really looked at the spirit at work? Every workplace is different. Leaders listen to staff feedback and act on staff concerns. Successful leaders focus on successes and the potential of the employees. They support and mentor individuals and teams, and they work at engaging staff to work towards a shared vision, and above all, they encourage RN autonomy. Managers have very similar needs to staff. Okay, so it's not just the frontline caregivers, care providers that we're talking about, but it's also the managers. Managers require organizational and social support. They require essential information to assist their staff with decision making. They need opportunities for continuing education, for growth and fulfillment, and they also require adequate staffing. It's so hard when you don't have adequate staffing to be really, really positive when you're in a position of management. And they need other resources to assist them to lead and manage a healthcare team that provides quality patient and client care. It is essential that each RN examines their personal experience and strives to reduce harm-inducing behaviors such as horizontal violence. However, it is also imperative that organization and caregivers alike investigate the presence or absence of structural supports essential to the empowerment and spirit at work of the caregivers. Increased management and peer support while controlling workload decreases stress and fatigue and leads to increased quality of care, is a direct quote from Jones and colleagues. And so we see that you can't be alone. You need to have that involvement of not only your management, but also your colleagues on the unit. But your workload plays an important role in your stress and fatigue. And when you're stressed and fatigued, it's difficult to provide quality care to your patients. Also, it's important to remember that management style has a significant impact on the well-being of caregivers. It is highly recommended that there be open discussion between management and employees, combined with all those workplace interventions that are focused on improving teamwork, management, knowledge, and or recognition of care providers and patient needs. We also need creation of a non-punitive workplace where harassment is eliminated, and this will contribute to increased spirit at work. So we just talked about the workplace interventions contribute to increased spirit at work by improving teamwork. And I would love to tell you exactly how to improve your teamwork, but I think what it requires is that open communication between staff and management. I think who knows better than the people who are in the workplace what will help them to be better team members. Management knowledge, sometimes just some workshops helping managers to understand different directions they can take to improve the workplace. We also look at the care providers and what are their needs. And also every workplace, every healthcare environment, there's different types of patients, as we all know, from the emergency department to the ICU, to the medical unit, surgical unit, and to the gerontological units. And finally, it's important to create a non-punitive workplace where harassment is eliminated. Finally, in this time of fiscal restraints, it's important to dedicate resources to these educational interventions. One of the things I have done in some of my research within Saskatchewan is to develop some spirit at work interventions and to include them in weekly huddles. And so what it really does, it focuses on the importance of the individual care provider and the relationship between them and their patients. These weekly discussions really bring to the forefront that the individual is important and the provision of quality care to our clients and patients is also important. So we can't just tell people, oh, this is what should happen. We really need to move it right into the workplace and provide support for ongoing discussion. So this brings me to the end of the information section of my presentation. I always close with this final slide. Who has seen the wind? Neither you nor I, but the trees bow their head when the wind is passing by. This really applies to spirit at work. We cannot see spirit at work, but we can all feel it and see the results of poor spirit at work in our workplaces. If you want to do any further reading on spirit at work or workplace health, I've included a list of references. And actually, I'll just step back a bit. Here's the second page of reference. I'll let you look at it for a few minutes. And the final page of references. And please feel free. I'm at the University of Regina. If you have questions or are interested in any of my research, I'd certainly love to share it with you. Any questions? Emery, do you have any comments?
Yeah, we'll just give it a few minutes and see if anyone types in any questions into the chat or the QA. Myself, I'm just watching that. I noticed a lot of emphasis on the manager side of it. What can an individual do?
I think really we're looking at the individual is to be very conscious of what is happening with their team members. When you have new staff on the unit, really try to work at taking a mentorship role, mentoring them, assisting them when they have difficulties and supporting them as they learn the how to function on that unit. I know I teach a leadership course here at the University of Regina, and one of the comments that kept on coming up in the first one or two classes in this course this fall was the students seemed to have really grabbed onto the phrase, nurses eat their young. And so we really talk about it a lot and say, and talk to them, does it help when that kind of environment, does it even help for you to say that? I mean, really, instead of saying that or thinking about it, work hard when you see negativity to turn it into positivity, to support your colleagues, because often when people are stressed and not in their best frame of mind, that means they are struggling and they need your help, they need your support. Have patience with each other, I guess. Very simple.
It's interesting you say that too. That was my other thought in it. I just look towards like my own work when I do it. And a lot of the times when I actually deal with members, I'm dealing with them at the worst point of what they're trying to do. So they're either having problems, online renewing or something like that, and they can't get through, and it's, they're finding it impossible. And that's when I actually finally talk to them. So if I'm having a bad day and that comes across on the phone or on video when I'm with them, then obviously that's not going to help the situation either.
Yeah. So what do you do in those situations?
I think it goes back to one of your first points where it's, you gotta keep your own mindset sound and just focus on that problem at hand and really focus on helping the other individual out, because that's more important than how I'm feeling at this moment.
Yeah. And that's where all the four concepts of spirit at work come into play, because I truly believe that you're taking a higher approach to this, that may be engaging, you're thinking of the well-being of the individual you're working with.
Yeah. Well, I didn't see any other questions coming in. Again, just a reminder, we will post this to our website. It'll actually get posted in our community of practice as well. If you have done your 2019 renewal, you should be getting emails to join the community of practice. I would highly recommend doing that. You can continue this conversation online more in greater detail later as well, with the video being posted in there. The other thing I need to get out of the way is next week's webinar topic. Should be a good one, an interesting one. It's on the legalization of non-medical cannabis and the implications for the nursing practice. So on October 17th, when that all becomes legal, apparently, what does that mean for the RNs, the AAPs, and the MPs out there, through all the legislation changes? I imagine the discussion and hopefully the community practice discussions will be interesting with that as well. And yeah, thank you for everyone who joined us today. And Joan, especially to you, thank you for presenting today.
Thank you. Bye.
All right. Have a good day, everyone.